You're watching Let's Chat.
Young, old, rich, poor, doesn't matter. One thing that affects all of us is our health. Not just our individual health, but the collective health of our community. Here to talk about that from the Hamilton County Health Department is Dr. Dawn Ford, and Dr. Ford is an epidemiologist. So, Dr. Ford, good to have you here.
Thank you.
The picture of our health report just came out a couple of weeks ago. In a nutshell, what is this report all about?
It is a community health assessment, and it summarizes the current health of Hamilton County residents. We do the report every 4 to 5 years so that we can track changes over time.
Tell me what's contained in this report.
Well, it's a very large report. It's 175 pages. We do also have some supporting shorter documents, but it has information about our demographics, infectious disease, chronic disease, substance abuse, injuries, vulnerable population data. It's very broad.
As a doctor, what is perhaps most alarming for you in this report?
I don't think there's anything that's alarming. However, we're seeing some trends over time that kind of line up with what we're seeing in the state and across the United States.
Like what?
An increase in overdose deaths, for example, with fentanyl.
Right.
We're also seeing an increase in chronic disease like obesity and asthma. We're also seeing an increase in prostate cancer. We actually have a higher prevalence than we see with the state of Tennessee.
Which, prostate cancer is so easily detectable and so easily treated if you catch it soon enough.
That's right.
Why do you suppose that so many men are getting this? I mean, it's on your checklist, the stuff from your insurance company. You should have this done every so often. Why do you suppose guys are just turning a blind eye to this?
Well, we're not sure. We just identified this, for the report. So that's related to what our next steps are. The health department's going to be, publicizing this report with community partners, healthcare providers, so that we can look into this further and then promote screening. And of course, that's important for prostate disease, but other types of illnesses as well.
And this is the first report, report like this you have done since the COVID pandemic.
That's right.
Correct?
That's right.
What is so different about this one? Are you seeing any commonalities between this one and the previous report, or are things a lot broader?
We include a chapter or a part of the report on COVID-19. We also we included survey results from our Hamilton County Public Health Survey that we did after COVID to kind of gauge what people's concerns are, and because they've changed over time, especially after the pandemic.
Refresh us a little bit as far as the methodology you went to get the information in this report.
Yeah.
Was it a survey? Was it online? Tell me.
All of those things. So we have data from federal, state, and local sources. We have data from our public health survey. We had over 3,000 responses from Hamilton County residents.
Wow.
So all of that data went into the report. It took about 8 months to put together. It's incredibly comprehensive. We're also going to follow up in coming months and work on a data dashboard that will be on the health department's website so that people at any time can go to the website and access current health data.
So tell me, now that you have all of this information, all of this data, which is obviously scientifically backed up, what are you going to do with it? What's the next step?
The next step is to get as many people to look at it as possible. So this is part of that plan. We will present at Regional Health Council, and then we will get feedback on what people think are the top issues and how we can start to address them even more than what we are currently.
How do those of us who are fairly curious about these things go about looking at the report itself?
Right. It is linked from the homepage of the health department.
Right.
It's also on our social media. So it is linked to a PDF of the report, and then we also have an infographic that's in English and in Spanish. We will be following up with fact sheets for each chapter as well.
Is this, and no offense to those of you in the medical community, but sometimes you use words that are this long, and a lot of us only can comprehend words that are this long. Is this broken down into understandable English or understandable Spanish that the average layperson can kind of get their heads around?
It's not written with the medical field in mind. It was written for the community. There's a glossary, there's links to resources to
Right.
help people understand it, but really those additional materials I was talking about, the fact sheets
Sure.
and the infographic, are to help communicate that.
And I would think in something like this that education is the first step towards prevention.
That's right.
And as I mentioned earlier, all of us want better health, not just for ourselves, but for the entire community.
That's
Dr.
right.
Dawn Ford, thank you so much for joining us.
Thank you.
Find out more about what this lady has been spearheading. I think some of the information might surprise you. And if not, it should encourage you. Take better care of your health. Health.Hamiltontn.gov. That's Health.Hamiltontn.gov. Stick around. More of Let's Chat right after this.